Getting health care to the underserved, that's right now in motion. Underneath conversations about politics and the economy looms the constant question of health care. Its skyrocketing costs. Should it be run by the government? And a host of other queries have been hovering over the landscape for quite some time. But for those who are not insured, underinsured, are in remote areas and simply have no access to quality health care, a completely different set of questions come into play. Greene County, Pennsylvania is a place where its inhabitants deal with these uncertainties on a daily basis. The county is mostly rural, and the federal government classifies it as medically underserved.
This is considered Middle Appalachia. It's had historically extractive industries without end product development, so that you have minimum wages. You have very little access. It's very rural. There's no public transportation. Folks have difficulty accessing. They don't have a lot of money. So combine all of those factors, and access to health care is extremely limited.
That's why 4 times per week, under the watchful eye of Dr. Mona Counts, a nurse practitioner, a team of healthcare professionals load out in this 40-foot custom-built RV and seek to span the distance that has many in this county isolated from medical care.
They wanted somebody that would not talk down to them, that would listen to them, that wouldn't leave when their loans were paid, that would take the time to understand their culture and try to address the healthcare needs within their culture. So I waited till I homegrown or I graduated some nurse practitioners to help me, because you can't do it alone. And we started the practice in Mount Morris. That was in 1994. And we have obviously grown. We now serve 6,000 patients out of that practice.
The work that we do here is important because it gives people a choice. Because of the way that Dr. Counts has organized the clinic and has traditionally run it here, we don't turn people away.
The primary care center, along with the mobile unit, offers all the services of a full clinic. The clinic takes payment for their services with insurance and on a sliding scale, so no one is turned away. Because of Dr. Counts' efforts, the practice has served over 6,000 clients. And with the student nurses she trains today, she looks to change how healthcare is delivered tomorrow.
I think the whole concept of culturally specific healthcare is something that needs to be in every curriculum in any healthcare profession. We have had the opportunity here to have interns and residents from all over the country, specifically because of the Appalachian nature and the specificity of that culture. So that all of the students that we have precepted or have gone through the practice, one of the goals of that experience is to truly understand the culture.
I think Dr. Counts, because it's all nurse practitioner run and there's that nursing background, there's a level of cultural competence that is just unbeatable, and the way that the patients trust Dr. Counts and the other nurse practitioners at the clinic gives a different level of care, and it allows them to really open up and go into the lives, and not just helping them medically, but helping them socially and in their lives themselves. It's all preventative care on top of the regular care that they give.
This program is funded until the end of fiscal year 2009 by the Pennsylvania Department of Health. But Dr. Counts hopes to make the clinic self-supporting by partnering with small businesses. But for now, she will continue to make a difference in the lives of the inhabitants of Greene County, the same way she's been doing since 1994.
Penn State is one of the first universities, and I've been around the country in a lot, that is a land-grant institution that is truly committed to its mission of improving the quality of life of its residents. And their appointment for me in an endowed chair to do this type of thing is increasing the community confidence. The students have the opportunity to rotate through here. They stay either with me or with residents in the community. And get an experience that's invaluable.
It has really been a blessing to me because it's always was close to me. I live in the country, but still it's close to me. And at this point in time, there's no other doctor in Mount Morris. That makes a big difference to a community.
For In Motion, I'm Kurt Parker.